when you hear about oxycodone or hydrocodone or one of these drugs, you actually should think about them as heroin. They're chemically virtually identical to heroin.
Your study of the economic effects of the opioid crisis, what have you found to be, in this specific time period, what do you think is the exact cause? What do you think happened?
What really changed starting in about the mid to late 1990s as we saw this enormous growth in the availability and use of prescription opioids. These are, highly beneficial drugs. They're very effective. The problem comes in when you have long-term use of them. They're addictive, and there's a lot of scope for abuse of those drugs.
Your prescribed opioid medication, continued to use it, developed tolerance, it was increased, and you continued, eventually you could develop an addiction.
The United States is facing a health crisis as more than 11.4 million Americans misuse opioids. Every day, more than 130 people die from opioid-related drug overdoses. But this is not America's first drug epidemic. In the 1980s, the crack cocaine epidemic had devastating consequences for communities.
Opioid epidemic and crack epidemic have a lot of similarities. They take lives, they kill communities and neighborhoods, and it's devastating. With opioid, we were seeing more death per day than we were seeing with crack cocaine. If you take just a little higher dose than your body used to, you die immediately. With crack cocaine, what happens was the repetitive use, people develop strokes, people develop other medical complications.
As you think about the policy approaches to this crisis versus maybe like the crack and cocaine crisis of the 80s and 90s, we can see like stark differences.
Yeah.
So where would you say those differences lie?
One of the key differences has to do with race. When it was crack that was primarily affecting blacks, it was being treated primarily as a criminal offense. Much of the strategy was stick people in jail. The opioid epidemic has been a much whiter issue. Again, not entirely, but more so, and it's been treated more as a health issue. I think it's terribly unfortunate that, the reason that happened probably has this large racial component to it.
At UVA Hospital, Dr. Ait-Daoud is the director of the Center for Leading Addiction Research, or UVA CLEAR. Using a hotline for questions about opioids, she is hoping to improve patient care and curb the effects of the crisis.
The response, it's always lagging, which is unfortunate. We see it happening and we're like, is it happening? Is it not? Oh my gosh, it's happening. And then we lose so many people before we put things in place. What we did is we developed an opioid helpline. If you have any questions, any concerns, you can call the number. Then we have people who are trained to answer your questions, give you educational information, and also provide support and even help with pain management.
There's no single magic bullet. I think it's going to be a combination of a lot of policies, a lot of interventions.
I'm hoping to see more things in place for us to deal with the next epidemic, and I suspect it's going to be the methamphetamine epidemic.